my name is Sophia. I'm going to be your nurse today. So today we're just going to be establishing your primary care. So we're going to be doing a complete head to toe assessment. We already got all your past medical history. Sorry. Alright, so the first thing I'm going to be doing is just inspecting your face, inspecting your scalp, your eyebrows, eyelashes, your nose, your mouth, your neck, just checking everything out, hair distribution. I'm going to start by palpating your scalp. Any pain or tenderness?
No.
Okay, palpating your ears, palpating your frontal and maxillary sinuses. Any pain or pressure, tenderness? Okay. Then I'm going to be palpating your nose, palpating your neck, making sure your trachea is midline. Alright. After doing that, I'm going to be doing a couple neuro assessments on you. So the first neuro assessment that I'm going to be doing is looking into your pupils. Sit straight for me. Right. So your pupils are responsive to the light, which is great. The next thing that I'm going to be doing is I'm going to have you stand up here, and I'll have you stand right at the end of the bed and read the lowest line on this chart for me.
FEZOLCFTD.
Perfect. So 20/10 vision with your glasses on. The next thing that I'm going to be doing is the visual fields test. So I'm going to have you cover either your right or your left eye. Perfect. And I will cover the opposite one. So tell me what number I'm holding up.
1, 2, 3.
Perfect. Opposite eye.
1, 3, 2.
Perfect. All right. So after that, I'm going to be doing the next neuro assessment, which is going to be the fundoscopic exam. So I'm going to take my light and I'm going to dim the lights now in the room, and I'm going to come in from the side and just looking at the optic disc and the red reflex. Perfect. Coming in from the other side. Perfect. The next neuro test I'm going to be doing is the cardinal fields of gaze. So I'm going to have you just follow my finger only with your eyes. Perfect. This is just checking for any extraocular eye movements, nystagmus, anything like that. I'm going to then be looking in your ears. So you said no pain or pressure in your ears. Good. All right. I'm going to come in, pull the pinna up and back. Looking at the tympanic membranes, and then I'm going to come in from the other side. Looking at the tympanic membranes. Perfect. And then going to assess your nose and just looking at your septum and your mucosal membrane. Looks good. Streak and pink. Looks good. Perfect. All right. The next thing that I'm going to be doing is a couple of ear assessments. So the first one I'm going to be doing is called the whisper test. So I'm going to cover this ear. Can you hear that okay?
Yep.
Can you hear that okay? Perfect. The next one is the Weber test. So I'm going to use this tuning fork and place it in the middle of your head, and you tell me if you feel it equally on both sides. The sensation.
Yep.
Okay, perfect. Then I'm going to do it on all of your extremities and just tell me if you can feel it.
Yep. 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 Yep.
Perfect. And then the next one I'm going to be doing is the Rin test. So I'm going to place it on your bone and then tell me if you can, when you stop feeling it, and then tell me when you stop hearing it when I pull it away.
Okay. Stop.
perfect. The air conduction is greater than bone conduction. Other side.
Stop. Stop.
Perfect. Air conduction is greater than bone conduction again. Next, I'm just going to take a look into your mouth, checking your tonsils, and then we'll check your gag reflex and your tongue movement as well. So I'll have you say, Can you stick your tongue out for me? Perfect. And then can you move your tongue from side to side? Perfect. And then I'll check your gag reflex. Okay, perfect. Gag reflex is intact. I'm going to do a couple more neuro assessments. Can you go like this for me, checking the rapid alternating movement, and then bring your heel up your shin for me, and the other one as well. All right, and then we're going to be doing a Dolan sharp test. So on each extremity, I'm going to place either sharp or dull, and you tell me what extremity and where you're feeling it with your eyes closed, please.
Sharp on my right arm. Dull on my left arm. Sharp on my left arm. Dull on my right. Dull on my left leg. Right leg. Sharp on my left leg. Dull on my left leg. Sharp on my right leg.
Okay, perfect. I'm gonna have you take a sip of water and hold it in your mouth, and I'm gonna be feeling your thyroid. All right, and go ahead and swallow. Perfect. Next thing we're gonna be doing is just feeling your lymph nodes around your ear, your neck, and under your chin. The preauricular, postauricular, occipital, the claviculars, cervicals, tonsillary, submaxillary, and submental. All right. I'm going to have you turn your head into my hand, turn your head into my hand, and then shrug your shoulders for me. All right. I'll have you clench your teeth and wrinkle your forehead, and then puff your cheeks. And then close your eyes and don't let me open them. Okay, perfect. So cranial nerves are intact. The next thing I'm going to be doing is I'm going to come around and I'm going to listen to your lungs on your backside. So first we're just going to start off by inspecting any pain or tenderness.
No.
Okay. When you feel my stethoscope, please go ahead and take a deep breath. Then I'm going to be percussing in between. Extra one on the right side. All right, and then I'm going to have you take a big deep breath. All right, chest excursion looks symmetrical on both sides. I'm going to be pounding on your back and tell me if you feel any pain or tenderness, okay? Any pain or tenderness?
No.
Okay, when you feel my hands placed on your back, go ahead and say 99.
99, 99, 99, 99, 99, 99, 99.
Okay, perfect. All right, come around to the other side. I'm going to just inspect again. Any pain or tenderness?
No.
I'm going to do the same things on this side, starting with listening. Then I'm going to be doing the same percussion on this side. And say 99 for me again. a couple
99,
times.
99, 99, 99, 99.
Okay, perfect. Symmetrical on both the front and the back for the vocal frematus. I'm gonna have you roll your hands around for me for your wrists. Perfect. And then spread your fingers apart and don't let me close them. Okay, and then try to open them. Perfect. And then hold your arms up like this for me. Don't let me pull. Don't let me push. Perfect. Go ahead and hold them out straight for me. Don't let me push down. Don't let me push up. Right, and then go ahead and place your hands like this for me. And then try to push down and push up. Okay, perfect. I'm gonna check capillary refill. Perfect. Less than 3 seconds. Less than 3 seconds. And I'm gonna feel your radial pulses as well. Perfect. All right, I'll have you lay down now for me. All right. So the first thing I'm gonna be doing is, actually, can I have you sit back up for a second? I'm gonna listen to your heart while you're sitting, and then I'll listen to it while you're laying. Alright, and then I'm gonna listen with the other side of my stethoscope as well. Alright, perfect. I'll have you lay down now, and I'm gonna do the same exact thing with my stethoscope, listening to your heart again. And then again with the bell side. So the next thing I'm going to do is feel your carotid arteries. So I'm going to have you hold your breath. Feel the other side. Okay, go ahead and breathe for me. And I'm going to listen again with the bell side, one at a time. Perfect. All right, perfect. Next thing I'm going to do is a breast exam. I'm just going to place this next to yours. Is that okay? All right, I'll have you raise your arms. I'm going to first start by feeling your axillary lymph nodes. Axillary lymph nodes. Any pain or tenderness? I'll have you place your arms down like this for me. Feeling those epitrochlear nodes as well. Then I'm going to be doing a breast exam. Just going around. Circular motion. Until I reach the nipple. Checking nipple discharge. Go to the other side as well. Going in that same circular motion. Checking nipple discharge. Perfect. Alright. So the next thing I'm going to be doing is I'm going to go down to your abdomen. And the first thing I'm going to be doing, if you don't mind me lifting your shirt, I'm just going to be inspecting. Right. And then right before I get to your abdomen, actually, can I have you lay on your left side for me? Alright, so we're just going to be checking for that PMI, thrills and heaves, and then as well listening to your mitral valve. I'm just going to place my hand right here. No thrills or heaves. And then I'm just going to listen to that fifth intercostal space as well with my belly and diaphragm. Perfect. I'll have you lay back on your back. All right. So going back to the abdominal assessment, we're inspecting. Any pain or tenderness? Okay, so the first thing that I'm going to be doing is just listening to your bowel sounds in all 9 quadrants. start in the right lower quadrant. Are active in all four quadrants. Next thing I'm going to do is just listen to the arteries around here. So starting with your aortic artery, with my bell side, listening for any worries. Alright, and then I'm going to do the renal right above the belly button. And the iliac right beside, right below. Going to be feeling those femoral nodes and linguinal nodes as well. Femoral arteries, sorry. Nodes, right. And then I'm going to be doing some light palpation first. Tell me if you feel any pain or tenderness. Now. Alright, the next thing I'm going to be doing is on this right side, I'm going to be feeling for your spleen, so I'm going to have you take a big deep breath. Alright, I don't feel your spleen, which is a good thing. We don't want that to be enlarged. And actually on this right side, it's your liver, so I'm going to be feeling for your liver actually instead. So I'm going to go underneath your ribs, have you take a big deep breath, and let it out, which is good because I do feel it sliding underneath there. And while I'm here, I'm going to be percussing the liver border. And then on that other side, the left side, I'm going to be feeling for your spleen, which we don't want to feel. So let me take a big deep breath. Perfect, which I don't feel, which is great. So then moving down, just assessing that calf refill on your fingers again. And feeling for those radial pulses. Okay, then I'm going to feel for your popliteal pulses right behind your knee. Feeling for your post-tibial pulses right on the inside of your ankle. And then your pedal pulses on top of your foot. Shift capillary refill. Alright, less than 4 seconds, which is great. Checking for any edema on your legs. Not noted, which is great. I'm going to have you push down and then go ahead and pull up. Perfect. Then I'm going to have you bring your knee, your shin up like this, and then back down. And then I'll have you bring your knee into your chest. Perfect. Out to the side, back, straight. Out, other side, back again, and on the other side we're going to do the same thing. So we'll have you bring your heel up, perfect, knee to your chest, knee to your chest again, cross, over, and straight, and back, which is great. Alright, so after I do that, I'm going to have you sit on the edge of the bed again. And I'm going to have you push your legs out to me. Alright, and then pull it back. Perfect. push up. Perfect. All right. So after that, I'm gonna have you stand up, and I'm gonna have you just walk normally over there. All right, and then walk back on your toes for me. Perfect. Walk on your heels. And then walk back heel to toe. Perfect. Then I'll have you stand right here, and I'm gonna have you bend over, and I'm gonna assess your spine. Just feeling for any curvature, any pain or tenderness. Okay, perfect. You can go ahead and sit back down for me. The next thing I'm going to be doing is some deep tendon reflexes. So starting with your arm, try to have your arm as relaxed as possible. Perfect. Now maybe bring it in right here. Just as relaxed as possible. That other side, doing the same ones, as relaxed as possible. Stand here. Perfect. All right, the next ones we're going to be doing is right on your knee.
I really think you got everything. That's what I was trying
No,
to
my
think.
computer shut off. Oh, it's still recording.
Oh, thank God.
Hi.